I'll say LKC is more free form in the sense that we have lectures but not in person, so all our material are uploaded online and we have the like freedom to decide when to study and when not to study. So I guess this one plus point. I'll say I'll say NTU is a very tight knit community because I guess in part the cohort is very small, so especially in between batches and even within the batches, people tend to be closer and there's this I guess community feel of everyone helping each other out because we are equally lost. So I guess if that's something that you think is very important to you, then yeah, you should come to NTU. Besides that, I guess NTU has like a double campus system. If you enjoy having the freedom to choose whether to live on in campus or to just spend most of your student life in the Novena campus, you get a lot of choice, a lot of freedom in choosing what to do lah. In terms of student activity, I think it's pretty much the same both ways, and I don't think there's much to say about that. My opinion is that exposure is the most important thing. So just expose yourself to the healthcare environment, to just learning what you're getting into. For myself, I could not get a attachment to any doctors. I sent a lot of emails and whatnot, but just couldn't get a spot, I guess. So I decided just go for a nursing attachment, and that was pretty eye opening lah. So I guess I would try to start earlier. Try to get attachments earlier. I mean, it's not a competition to get attachments or I don't think there's any immediate bonus or getting an attachment, but I think it is important to to acquaint yourself with the environment. At least know not just for the interview, but to know for yourself whether it suits you. So I would think starting earlier and getting more exposure by asking more doctors, physicians, nurses, anyone in the healthcare team, and just getting to know more. In my year, I was not aware of NHMed, so I could not get these resources. But I guess now since you all have the chance to do so, it will be a great opportunity to find out more through NHMed. So one experience I've had so far that I guess was very memorable for me was during our hospital week. Basically, in year one, LKC students have a chance to pop by the hospitals for a few days, I think about a week, to just see how the atmosphere is like and I guess talk to some patients and ease our tensions. So we were going on hospital rounds. I remember seeing this patient he looked very jovial and was very willing to talk to us. He was bedbound and he just didn't seem like the type to be in such a serious condition since he was so upbeat by everything. But the more the doctor shared about his condition, the more I realized how grave his situation was. Then he was still not too bad because he could speak and he was able to move a bit. The main issue the doctor told us that they were facing with him was that he didn't want to go back on kidney dialysis even after the surgery was done and completed, and that would really help his condition. But he just refused to do it because he had prior experience with it, and he was very bored and his livelihood, and he just felt very drained after all of it. So he really did not want to do it anymore, and as a way to open our eyes about the realities of medicine, the doctor asked us to just talk to him about it and see if we can try to convince him to go for dialysis lah. So when we talk to him, first thing of course we need to listen, we need to inquire about his life, to know more about him lah. And he shared with us his story. He is such a interesting character because he went through Burmese death rail. Like he was forced into labouring by the Japanese. So he escaped from it. He was very willing to share with us stories about that, and he just seemed very upbeat and lively. When we started asking him about why he did not want to go for dialysis, he shared with us all his reasons about spending more than 3 hours, I think 3 times a week, going to the dialysis center and just having a lot of things taken from him in the sense that in the past he could move around, he could play golf with his friends, he could meet up, he could talk to his kids, and he felt very restrained by having to do dialysis. And that's the main reason he didn't want to. My team and I guess tried to convince him through many ways lah. I guess trying to talk about him, his family missing him, his children, But he at every turn he he had a reason, or he already made up his mind that he did not really see the point in living. He felt that there's no point in living anymore since his best days are already behind him. He his children are all successful and studying, and he did not see a need to continue living lah. And midway through, I guess, he started bringing in the topic of faith and how that brought meaning to his life. And I'm not a very religious person. When we picked up upon that, we started to prod him in that direction, trying to help him see that anything, even faith or anything that he finds meaning in, there's nothing wrong with that, and there's not that is completely uh, reasonable and logical meaning to his life. So we started asking him about like his volunteer work, asking him what he did in church and whatnot. And the more we prodded him along that way, the more I started to see that perhaps he actually has a reason to live, and that our role there was basically just to point him there. There's some happy news is that I think 2 days after we left, oh no, one day after we left, we heard that he started walking around. He was more willing to go further. Since he went for one, I'm not too sure what happened after that, but it's just quite reaffirming to see that there is, I guess, some change to be made, and that sometimes a little communication is all you need.